give us a little history lesson.
Okay.
and
Yes.
tell us how and why that history is so important to this moment of destabilization and understandable mistrust that's made all of us more vulnerable.
And I want to say, I think the issue of mistrust has several layers because, and I'll get to the history lesson, but I also want to say that, we want people to have the information that they need to make informed decisions for themselves. We don't want to be paternalistic, but I feel like we've gotten to the point where people don't know where to go for accurate and responsible sources of information, right? And then we have dominant voices putting out misinformation. It's the same,
we have the government,
right? And
putting out misinformation,
right? Exactly. And we have communities that are hearing all of these messages and not knowing who to listen to, right? And so I think part of that I get because we have a history where, actually, let me first ask, who's heard of the Flexner Report? So I see probably a quarter of the people in the room have heard of the Flexner Report, but the Flexner Report of 1910 is one of the reasons why today we don't have a healthcare workforce, not just physicians, but nurses and other health professionals that reflect the population of this country. I would say by 1905, there were about 1,500 Black physicians in this country, and they had been trained by 7 historically Black medical schools. In 1910, the Carnegie Foundation, the American Medical Association, commissioned Abraham Flexner, an educational specialist who actually was known to hold racist views of Black people, who felt like the only reasons that Black students should be in school with white students as sanitarians to prevent white students from getting sick. They commissioned him to go around to all 155 US and Canadian medical schools and assess them against the gold standard here in the US, Johns Hopkins. So what were their admission criteria? What were the percentage of physician scientists on faculty? So looking at just sort of how rigorous the curriculums were. And so based on that report, some predominantly white schools closed, but also 5 out of 7 of the historically Black colleges were closed. So 5 were closed, leaving behind Howard and Meharry in 1910. The Journal of American Medical Association, actually in 2020, published an article that estimated if those 5 schools had remained open, they would have educated between 25,000 and 35,000 Black physicians. 25,000 and 35,000 Black physicians. That number, think about that number, but also the issue also is that still to this day, historically Black medical schools educate the most Black doctors. So that's the other issue. They're still doing the heavy lifting. But think about how many patients those tens of thousands of physicians could have treated. Think about the research that could have been done, the communities that could have been served. And so we know the Flexner Report impacted actually midwifery, it impacted dental professions and other allied health professions. So it really made a difference. And so when we look at statistics now in terms of, or just even studies, around observational studies around racial concordance in care, meaning the clinician and the patient are of the same racial background, we know for Black patients and patients of color, it makes a difference. We know that people are more likely to follow their physician's recommendations. They're more likely to leave the encounter with a positive feeling. We know that even in one US county, in a US county, having one Black primary care physician actually improves the life expectancy of Black people living in that county and actually overall life expectancy. But the fact is that only a fraction of US counties even have one Black primary care physician, right? So we have to think about all of the reasons for the mistrust. And I often talk about how, medical mistrust is framed as something that the patient has, the community member has, and I like to reframe it as institutional untrustworthiness, because our country has had a history, and it's not just, people mention Tuskegee, it's not just Tuskegee, it is the foundation of what medicine is in this country, has been founded on using and exploiting Black bodies from slavery. to make discoveries that were very important, but still done in the most horrific ways. And so we need to have so many layers, but we need to have, to reckon with that. We need to have acknowledgement of the harm. We need to have what repair still looks like. And this is why hip hop public health is so important, because the work that you do is forming that relationship with community members to say, we see you. We see you. We see what's going on in your life. And we want to co-create with you, right? Right, it's not we're gonna tell you what to do. We wanna power share with you, right? And that's something a lot of health-related organizations don't do. So I could go on this forever, but I also just wanna say that we need to think about, the public and different demographics and why that mistrust is there. And think about what are we doing, and what are you doing in all your respective roles in academia, in biopharma, and how are you engaging with communities to really center their voices, center their concerns, right? Are they on the boards of your organizations, right? What does health equity look like to them? We know we think we know what metrics we're using are important, but what does good health mean? It can mean more birthday parties, no missed retirement parties, more graduations, right? That's living. So I think we really need to think about how we're communicating about health to and engaging with communities.